I know we'll have folks trickle in, but they do, I'll kick us off. Good morning, everyone. My name is Tanya Curiel. I'm with the Oregon Health Authority, and I will be facilitating our office hour session today. This is the monthly office hour session for HRSN service providers. This 2026, we've decided to listen to some of your feedback from last sessions and have these meetings a little earlier. So hopefully this time works for you all, but please, as always, let us know your thoughts and feedback. We can go to the next slide, please. All right, a few Zoom tips. If you are new to these meetings, thanks. I know sometimes we have like tech PowerPoint glitches that make the slides go back and forth. I promise this is not our staff's fault. So thanks for your patience. Zoom tips. If you are new here, the Q&A function is how we submit questions. If you haven't used the Q&A function, it's at the bottom of your screen where you see different icons like show captions or chat. You might need to click the little button that says more to find the Q&A function. But you can click on that and submit your questions. And then once it's time for our Q&A, we will either answer your questions in written form using that function, or we will read your questions out loud. This session is also being recorded, and we post the recordings as well as the slide deck on our HRSN provider training webpage, and we will share that link to that webpage in the chat for you. Usually it takes us a couple days to get those posted, but it will be available for you after. The closed captioning button at the bottom of your screen can help you turn on the closed captioning function. And live interpretation. This year we haven't had any requests for live interpretation, so we are not currently offering it. But if you need live interpretation for future sessions, please let us know, and we're more than happy to start providing it. But as I said, we haven't had any specific requests for it, so this session doesn't have it. But we are more than welcome to provide it for you if you would like. Next slide, please. All right, on the agenda for today. So we're doing our welcome and our introductions, then I'll hand it off to our colleagues to talk about community capacity building funds and the grant program survey results. So they will share that. Then we'll do some updates and follow-ups. You'll hear some reminders and new information about the HRSN program. And then we'll open it up to our office hour sessions where you can ask our OHA subject matter experts questions about the HRSN program and hopefully get you some answers. We'll wrap things up by talking about upcoming opportunities and share the upcoming office hour sessions as well as additional resources about HRSN. Next slide, please. All right, and with that, I'm going to hand it over to Lisa to kick off the presentation on community capacity building funds.
Thank you. Good morning, everyone. Lisa Croyce, she, her pronouns, and I'm the 1115 Senior Policy Advisor. I also want to, I'm just looking across the virtual room here. I want to ask my colleague who really led the CCBS survey work to introduce herself as well. Sorry, I'm hoping she's able to join.
I'm here, Lisa.
Oh, great.
Good morning, everybody. My name is Margaret Braun. I use she, her pronouns. And yeah, I am I'm a program and evaluation and policy advisor working on a couple of different areas related to research and data collection and evaluation for the 1115 waiver, including HRSN. So I was happy to conduct some analysis and help develop the survey for grant applicants, and even happier to be back here presenting those findings to you. Thanks so much.
Great. Thanks, Margaret. Could we go ahead and go to the next slide? So before we dive into the survey results, I do want to just remind everyone what community capacity building funds are. And just, again, just to kind of give us a little grounding on what we're going to talk about. We conducted a survey after each year of this 2-year grant program to really understand. Last year, of course, it was really critical to understand what really worked well for people and if there were barriers that we could improve to the grant program and the opportunity. And then, of course, this year we wanted to understand if those changes worked so that we can, while there isn't another year of funding, we do just want to continually learn and improve how we manage these grant programs as opportunities come forward with each initiative that we have. So just a reminder again, this was the Community Capacity Building Funds. This was authorized for health-related social needs provider development. These were resources through our 1115 waiver. CMS authorized up to 119 million. This opportunity was managed through their coordinated care organizations who conducted a 2-year grant program. There were standardized requirements across all CCOs, including an application, a budget, and even the timeline for funding. There were eligible partners such as community-based organizations and others who applied for the funds, again, to support the HRSN program and the provision of those services. And then a reminder, there was 11.9 million of these CCBF funds that were set aside for the tribes. And that was managed through a different process, not through the CCBF grant program. Next slide. Please, thank you. And then just a reminder, these funds had allowable uses. So again, they were all dedicated towards HRSN. And then there were kind of 4 broad categories that they were to be used for: technology, development of business or operational practices, workforce development, outreach, education, and convening. And then next slide, and then we'll get into the survey results. Okay, so I did want to just kind of recap a couple of changes that we did do to the 2025 grant program based on 2024 survey results. So this was really feedback that we heard from HRSN providers and applicants, many of whom may be in this virtual room. I know a lot of you participated. Wanted to share that we, based on that feedback, updated the CCBF application and the budget template from 2024. We also pulled forward and highlighted opportunities around organizational types that weren't really emphasized in 2024, but were allowable, which were what we call hubs or conveners. Hubs are kind of coordinated organizations who serve in different roles, but are coordinated together. Conveners are convening HRSN providers to share things like best practices and, operational best practices, things like that. So we pulled those forward. We included more background information in the grant applications. We linked to benefit descriptions. We just kind of made all the information around being an HRSN provider a lot more accessible within the application. We also required CCOs to clearly state priority areas of funding for the 2025 grant program. We required them to meet with any applicant that was not going to receive their full amount that they requested. This happened quite often in 2024 because, there's only so many resources, and so CCOs had to make determinations around amounts of funding. It wasn't always the full amount that an organization requested. So we did require them to go back and work with an organization to ensure that the amount that they were going to allot still would meet their needs. And then we also, in 2025, had CCOs share all their application and approved and elected to award that organization or not. They shared all that information with OHA in 2025. So those are some key changes that really came out of 2024's survey, and we think that it improved and hopefully benefited organizations that were participating in the process. I'm going to turn it over to Margaret, who's actually going to share the results of the survey, what we heard from the 2025 process. So, Margaret.
Great, thanks, Lisa. I just realized I didn't have my camera on when I introduced myself, so hello, everyone. If you go to the next slide. The survey that we put out after the award opportunity was sent out and after folks applied was offered in 2025 only to grant program applicants. As Lisa mentioned earlier, we did this survey in 2024 as well, but in 2024 we sent it to a broader range of individuals, whether they applied or not, and we gathered some information about reasons why people didn't apply. So we have those findings as well. But this year in 2025, well, last year, I guess in 2025, we sent it only to folks who had actually applied for the grant opportunity. We sent it out September 17th through October 6th. It covered a wide range of topics, organization demographics, the application process, what went well, barriers, challenges faced, technical assistance offered by CCOs, and then new in 2025, we actually asked people to directly compare the application process in 2025 to the application process in 2024 if individuals, organizations applied in both years. We had a great response, I thought, 102 responses, and it was about a 41% response rate. Next slide. Before I get into the specific findings, just a really quick overview of the highlights. As I already mentioned, it was offered to applicants. We had a 41% response rate. Applicants were concentrated in the northwest area of the state and along the I-5 corridor, not that surprising. Most applicants identified as a CBO and serve a very diverse list of communities. Like in 2024, the most requested funding category for the grant opportunity was workforce development. Applicants reported that there were improvements in the 2025 application in terms of the clarity, the time it required to fill out, and the overall process compared to 2024. And then we also asked people to share suggestions for further improvement, and there were still a lot of them. So still a work in progress. We're still learning, and really thrilled to get that feedback. Next slide. So as I mentioned, we had a high concentration in the northwest corner of the state and along the I-5 corridor. When we asked organizations which counties their organization provides services in, all 36 counties are represented by the respondents. So there was at least one respondent in each county. There were 14 respondents who indicated that they offered services statewide. So they get a tick in every county there for the counts. And that's kind of what the heat map looks like in terms of organizations that applied for CCBF funding in 2025. Next slide. As I mentioned before, the most popular category for applicants was workforce development. You can see 2024 to 2025 compared there. It was pretty similar between the 2 years. Second most popular was outreach, education, and convening, followed by technology, followed by development of business or operational practices. Next slide. We also asked folks to say what CCO their organization applied for CCBF through. Organizations applied to a wide range of CCOs. Half of our applicants said that they applied to Health Share and or Trillium Tri-County, which cover that Tri-County area up in the northwest corner, high population density. But then there were a number of them who applied also for CCBF through Pacific Source Lane, was another popular one. You can kind of see the spread there. And you can also see again what it looks like 2024 compared to 2025. Pretty much the same order of, I guess, most popular CCOs to apply for to CCOs that didn't get as many applications or not as many applicants indicated that they applied there, with a couple of changes in popularity, I guess. Next slide. So I'm hoping not to confuse you by the next two slides, but please, say something in the chat if it is confusing. In 2024 and in 2025, like I said, there were slightly different groups that we sent these surveys to. 2024, we sent it to a very broad range of organizations, whether or not they applied. 2025, we sent it to anybody who applied only. But we asked the same sets of questions in each application, or excuse me, in each survey, asking folks to talk about what they thought about the application. And doing this helped us identify whether or not we'd made any improvements in these different areas between 2024 and 2025. So you can see here, there were big improvements, I guess, in the number of applicants who said that the amount of time it took to complete the application was either somewhat or totally acceptable. The majority said that it was okay in 2024, but literally almost everybody said that it was great in 2025. In 2024, about 2/3 of the respondents said that the application and its questions were somewhat or very clear. But then again, almost 100% said that the application and its questions were somewhat or very clear in 2025. And then only half of survey respondents in 2024 said that the overall process of completing the application was either somewhat or very easy. And then 3/4 said that it was somewhat or very easy in 2025. So we were very happy to see these results that suggested that the improvements that Lisa went over earlier did appear to be helpful to most folks. Next slide. And then, as I mentioned, we asked some specific questions only in 2025, asking organizations who had applied to both 2025 and 2024 grant opportunities to tell us directly what they thought of the improvements or the differences that were made. So we asked, how did you feel about the 2025 grant application, budget proposal, and overall process compared to 2024? So this set of questions was only asked of organizations that applied, once again, in 2025 and 2024. So the overall CCBF grant process, it was about a 50-50 split, saying that it was better than 2024 or the same as 2024. The 2025 CCBF grant budget proposal compared to 2024, about half said it was about the same as 2024, 40% said it was better than 2024. And then the application itself, 2025 compared to 2024, again, split about half and half, same as 2024 or better than 2024. So it's, I think it's difficult, I guess, or challenging to compare these findings to the ones on the previous slide, but overall, we feel like at least it didn't get worse for most folks in 2025 compared to 2024. But overall, we feel good about the survey responses, except indicating that they felt 2025 was a little bit better than 2024, or at least the same. Next slide. So this is where we asked a series of questions about what folks would recommend that for continued improvement into other grant years. Even though the CCBF grant funding is over, we have other grant opportunities that come up. So we also asked them to just kind of type in what they thought was improved in 2025 compared to 2024. The grant application appeared to be improved compared to 2024 in terms of it being clearer and also less repetitive. It didn't ask for the same information over and over again, just the most important information. We really did a lot of work on the budget proposal between 2024 to 2025 to hopefully make it a little bit easier. And individual organizations that applied indicated that they noticed those improvements and appreciated them. And then the clarity and expectations were also improved between the grant years in terms of CCOs being more realistic about what would be available, a little bit more transparency there, and then clearer information on what was wanted out of the 2025 process compared to the 2024 process. Next slide. Regardless, though, we still asked if there were areas for continued improvement. One of the biggest challenges that applicants grappled with, and frankly OHA grappled with as well, were the limited use of funds. It was OHA's requirements. I'll just read this. OHA's requirements and limitations for the use of funds causes the program to be challenging to fund and support within the framework of our existing business operation. We were told certain legitimate and necessary expenses would not be allowable budget items. And then there was also quite a few comments about room for improvement still in the communication, particularly communication between OHA and the CCOs. So there are a couple of comments there, just kind of a lack of communication, you know, and then also there was quite a few comments about the timeline, I guess, and the lack of communication over a long period of time. So that second to last comment there, we waited months and months and months for anyone to let us know if we got the 2024 grant or not. And that is also happening in the 2025 process. And then not only were there comments about the lack of room for improvement, I guess, between OHA and the CCO's communication, they also, applicants also wondered whether or not there was room for improvement or suggested that there might be room for improvement among CCOs that overlap in certain areas. So this last comment, we'd like to know how closely the two local OHP providers are working together or sharing information on applicants. So definitely some room for improvement in communication for sure. And although although OHA is limited by CMS on the use of funds, certainly there could be more room for improvement, I guess, in transparency. Next slide. And then we asked people just to give us their overall thoughts about the 2025 grant process and their experiences with it. And we had 38 responses and identified a couple of different major themes. Overall, there was, and actually these are in order from most comments fell under the top listed to the fewer comments under the end of the list there. So most of the comments were really gratitude for the opportunity. So that was exciting to hear that it has been helpful for people, helpful for organizations. The critical nature of the CCBF grant dollars in sustaining programs and helping them serve their communities. There were a number of comments regarding challenges implementing the grant program itself and HRSN in general. We definitely have heard those. Potential benefits and a lot of really great like specific comments and around centralizing communication instead of having communications come from OHA and CCOs, and not only CCOs, but lots of CCOs having a more centralized communication process. Feedback and transparency about the award process and decisions. So potentially shortening that timeline or making sure that CCOs are communicating with applicants in a timely manner. Continued conversation or chatting and comments about OHA's lack of understanding, OHA's and CCO's lack of understanding, needing to understand more about CBO's unique challenges. Suggestions for shared learning opportunities, so that like offering opportunities for HRSN providers to come together to talk to each other and learn from each other in their implementation of HRSN. And then there were quite a few comments also about just kind of being disappointed with the delays in the notice of award. Next slide. So I will end here just with a couple of key takeaways from the CCBF applicant survey. In general, the survey responses showed that there were some overall improvements in the experiences of folks who applied in 2025 compared to 2024. As we just kind of went over, there were still a lot of areas that were highlighted for additional improvement, including increased transparency and communication, clear expectations around the notice of award timelines, ask for more technical assistance throughout the process. For example, live Q&A sessions, recorded webinars, and assistance completing the application. And then some suggestions for centralized communication and a standardized application and submission process. But once again, we were happy to see that applicants expressed gratitude for the opportunity, indicating that these funds are helpful and critical to applicants' budgets. And but overall, we were happy with how the responses went and what folks had to say. So, and I think that's my last slide.
Thank you so much for sharing that update. Don't know if our providers on the call have questions that we might be able to get to after our updates when we get into our Q&A section. But I will go ahead and jump into updates because I don't see any comments in the chat. All right. So much, Lisa and Margaret. So, okay, we've got some updates for you. We're going to go through some of this you've already received in your inboxes, but we just want to cover it verbally and make space for questions you might have or any clarification. Several billing updates, some tweaks we've made to our OAR, and just a reminder of what went live on the 1st of January. And then just a new resource and some other things that we'll cover briefly. So let's get started. Okay. Our HRSN billing guide, we updated this last month, and we sent out an email, but I just want to go over some of this. It's, kind of dense material, so make sure everybody has access to this information. We, first off, we updated the definition of utility arrears. These are now going to be considered arrears if their date of service is before the member started receiving rental assistance. And this change was made in response to feedback that we heard from providers to really simplify how to determine what is forward versus arrears and ensuring that there is no gap in service. So particularly when there is a delay between the date the service is authorized and then the date that the member receives the services. So we hope that this will kind of help streamline some of the utilities billings for our providers. And then we also heard from our providers some issues with the address on utility bills. So we clarified in the billing guidance that the address on the utility bill is only required to match the member's address on the lease or rental agreement if it's included on the bill. So, if it's not included, then that's okay. It's still an acceptable form of documentation. If there is an address on it, though, it does have to match the address that's on the rental lease agreement. And then we updated utilities date of service flexibility. So now our HRSN service providers can use the due date of the utility bill for the date of service. This change was also made in response to some feedback we heard from providers to help simplify determining that date of service on utility bills, which can be somewhat complex trying to read those. So, for instance, if an electricity bill is due in January, then it can be billed as forward utilities for January. So to bill, we are asking that you use the utility payment due date as the date of service. If the utility bill due date is used as the date of service for a particular utility, we really need to ensure that the combined rent and utility payments for the month does not exceed the upper payment limit still, and that the member's benefit for any one utility doesn't exceed the 6 months. So if you do choose to use this due date as the date of service, just kind of keeping in mind those programmatic requirements of upper payment limit and 6-month benefit cap. And then, making sure that you're consistently using that across the 6 months as the date of service. So just making sure there's consistency there. And then, Yeah, so next slide. Perfect. We have utilities billed by the landlord. Those can be paid for with rent in the month they are charged on the rent ledger. So using that same date of service. If there are multiple months of landlord billed utilities with service dates, they can be treated like other multi-month utilities and spread across months. Oh, I'm seeing claps and hearts, so this is great news. We really do appreciate all your feedback. This is how we were able to make the changes, so I want to send hearts right back to you all. The next change we made was clarifying guidance for our prepaid utilities. So basically, our prepaid utilities, things like phone minutes, bulk fuel, can be reimbursed like billing for a standalone utility that isn't bundled with rent. So these utilities may be reimbursed by two methods you can choose here. Billing the prepaid utility cost in full with a date of service that reflects the utility purchase date, or by splitting the utility costs into billable amounts that are attributable to each month that the utility is meant to cover. So for each month that the prepaid utility intends to cover option, this month must count towards the member's 6-month benefit cap. It's just a reminder there, even if the cost is billed in full in one single month, if it's really meant to be attributed to multiple months, you want to make sure we're tracking those months for our 6-month limit. So an example of this could look like for propane purchased in December, it intends to cover the months of December, January, February. That will count as 3 months towards that 6-month limit. And then, additional propane can't be purchased during those months since the 3 months have already been attributed to that payment in December. So I know this is a mouthful, it's a lot of material, and we will have QA time for any questions that are coming up from the group. So our next slide. Okay, so a little rental assistance billing update. The date of service flexibility for rent payments. So the date of service entered on an invoice or claim can be up to 10 days before the first day of the month that the rent payment is due. As long as the dates of service are consistent. So, for example, if you use a date of service 10 days before the first of the month for 1 month, you really should continue that consistent approach throughout the 6 months of the benefit. It just, for awareness, you probably are aware, previously the guidance was that the date of service had to be on the first of the month. So this is just allowing a little bit of wiggle room and flexibility for our providers to get all of the rent checks out in time and to avoid late fees. So next slide. Okay, we've closed out our billing guidance updates. Hopefully that was helpful. Now we have some OAR updates. A couple of these are going to be overlapping. So here are a couple things twice. But I did want to just remind everybody we're in the new year. Happy New Year. And we did have, as of the first of this month, some of the changes that we covered last month are now in effect. And so I just wanted to remind everybody that we are no longer requiring landlord permission for home remediations if it isn't required by the member's lease agreement. So that really has to be thoroughly checked. Make sure if it's not required, that's okay. You can move forward with any home remediations. We also updated rule to require that the lease agreement and income verification are going to be required to really have a complete HRSN rent and utility financial assistance request. And then we modified that clinical risk factor criteria specifically for rent and utility financial assistance. So next slide.
Leah, I think Jesse might be able to speak to the last slide. There was a question in the chat that we could address during that slide. Oh, you're on mute, Leah.
Oops. Okay, that sounds great.
Yeah, do you want me to read the question?
Yes. Is it the yes, go ahead.
Okay, I'll read the question and then I'll let Jesse speak to it. So the question is, with the new OARs, there have been more of our clients who have been denied, as well as some other providers have reached out to me with a similar experience. These treatments and supports must be documented in the member's clinical records. Member attestation alone cannot be accepted. We are wondering what documentation is required. We thought that CCOs would be reviewing clients' insurance records for this information, though we have clients still being denied when those eligible clinical risk factors should be documented in their records. I'm wondering if there is any guidance your team can provide. So I'll let Jesse
Tanya,
speak to it.
and thanks so much for that question. So in terms of the rules that have gone into effect January 1st, 2026, it is true that for all for HRSN clinical risk factors needed to support eligibility for the rent and utility benefit, they must all be verified with some sort of documentation, with the exception of domestic violence, which is still a clinical risk factor that can be self-attested to. And that is correct that the CCO should be reviewing any of their records, claims data to see if there are any if there's any evidence of one, the diagnosis, and as well as any evidence of treatment or supports or an upcoming surgery or outpatient visits that can substantiate kind of that second component. So there's two components: the qualifying complex health need, and then secondly, the qualifying treatments or supports. And so I think that documentation could vary. We certainly expect the CCO to be reviewing their systems. If there is not any of that documentation and kind of the information they have, the member is welcome to submit additional documentation, and also able to exercise their right to appeal the decision as well, and provide that documentation. Any follow-up on that? Does that answer the question? Please let me know if there's any additional follow-up for that.
Thank you so much for answering my question. I think there's just some confusion that based on what clients have shared with us and then the other provider that reached out to me, what clients have shared with them, that the documentation should be in their records. The other provider works a lot with people in like drug and alcohol treatment and are seeking services that are covered under OHP pretty frequently. But that client still got denied. And so just kind of confused as to um, what additional documentation needs to be provided, or maybe what the CCOs aren't able to see on their um, records. You know, we have a client that just got denied and she's pregnant. But from our knowledge, she has been seeking, um, support for her pregnancy, but she still got denied.
Okay, yeah, so how is that conversation going with the CCO? Are you able to kind of help navigate that for the member, or is this past the point of where the member's already received the denial?
Yeah, so for all three instances, well, more two, that I'm referring to, the member has already received the denial. And the other HRSN provider reached out to the CCO and they did reply back and they were provided comments saying these treatments and supports must be documented in the member's clinical records. Um, and that's the provider that works more with clients seeking like treatment for alcohol and drug services. And so they said that that client seeks those supports on a weekly basis, but they still got denied.
Yeah, I would encourage the member to exercise their appeal rights if they feel that they have been denied erroneously. And that denial letter from the CCO or the health plan should have that information. Without kind of having the specifics of the case, it's hard to say if there was another reason why they were denied or if there was something
Yeah.
that was so. Yeah, I would definitely ensure that they have the knowledge to use that pathway.
Okay.
And we can certainly take this back to CCOs as well. We have a work session with them next week, and we're planning to check in with them on how it's going with the new rules that are now in effect. So we can kind of talk about any challenges or gaps in documentation that we need to be aware of.
Okay. Okay. Thank you so much for that information. And just one last question. Is there a time frame that CCOs need to provide that denial and appeal information to clients?
So they are under the new rule starting January 1st, 2026, required to authorize or deny an HRSN request within 7 days of receiving that complete request. If the request isn't complete and they don't have enough information to make that determination, they can potentially get an extension for an additional 14 days. So we're talking about anywhere from 7 to 21 days. And that denial letter that is sent should have that information on how to appeal. And I believe, OHA colleagues, correct me if I'm wrong, that the member has up to 60 days to appeal that decision.
Okay. Thank you so much. I appreciate you answering my question.
Thanks for the question.
And Kara, I see your hand up.
Yeah, thank you. I kind of had a follow-up question to this. Just when we are working with people to apply and we're trying to see whether they qualify based on this complex health condition with access to, healthcare services in the past year, does that, like, I'm curious of what they're looking for. Is it like you have one claim in the last year that references this? Would visiting your primary care doctor for like your annual checkup qualify? Like, how is that kind of evaluated on the back end so that we can, kind of better assist our clients and understand whether they qualify for this based on what kind of treatment they've had?
Yeah, thanks for that question. So there's two components for the clinical risk factor that can go into the eligibility criteria. One is that they do need to have a complex health need, so a qualifying condition. So it's not just engagement, like for an annual checkup, or well child checkup. It's not just engagement with the system. It's that complex health need. And then we have in OAR 410-120-2005, we can put the link there in the chat for folks, a list of what those qualifying conditions include. And then on top of that, it's the qualifying treatment or support within that time frame. So scheduled surgery within upcoming days, hospitalization in the past 365 days, engagement with mental health, psychiatric, or substance use disorder residential treatment in the past 365 days, recurring emergency department or urgent care visits for that condition in the past 365 days, or it could be increased frequency or high utilization of outpatient services. And that includes with traditional health workers or health plan case managers in the past 365 days. So, Kara, does that help answer your question?
Yeah, so, we work with people living with HIV and AIDS. So they have, that complex health condition. And so we're just trying to figure out, okay, if you're taking your meds and just going to your doctor as planned, does that because it does require kind of more regular healthcare services, does that qualify, or is it, quantified in some other way? So what I'm hearing is like, okay, beyond your like annual, maybe you're having worsening of symptoms or something, and so you schedule additional appointments because of those symptoms or worsening experiences,
Yeah.
or
Mm-hmm.
other. Okay.
That's right. So the qualifying, disabling, progressive, or life-threatening condition, and then the qualifying treatment or supports that are resulting from that condition. Mm-hmm. Yep. So what you described there makes sense.
Okay, perfect. Thank you.
Mm-hmm.
All right. Any other questions on eligibility you want to cover while we're here? All right, we'll move on. I just have a few more slides. Okay, so we kind of covered these topics earlier in our billing guidance, but we made just a couple tweaks to our OARs to reflect some of the billing guidance that we've updated as well. So that removing the proposed language we had intended to add, we removed this that defined our past due rent payments as past due at time of authorization. So we got rid of that language to make space for our new updated flexibility. And then we also clarified again that the address on the utility bill is only required to match the member's address on the lease and rental agreement if it's included on the bill. So we just made these things more in stone on our OARs. Next slide. Okay, so then because we did change the clinical risk criteria for our rental assistance and utilities program, we split out request forms. So we have some updated request forms to really reflect that new change for the rent assistance. So just as an FYI, these are available on the website. Keep in mind that this primarily is for our open card members. The CCOs can choose whether or not to utilize our OHA developed request forms in lieu of their own forms. So it's going to be CCO dependent. But we did make some updates to really account for that new clinical risk factor criteria, and also that the income verification and lease agreement will be due at the request form request time. So these are all going to be included in the new rent assistance request form. Next slide. We developed a new resource that's on our website, and this is the guide on giving IN clerk access in the MMIS provider portal. So this is really just to help any open card or fee-for-service providers understand what that process looks like and the benefits to providing MMIS provider portal access to help with any HRSN billing challenges that can arise. So we hope this is helpful. If you're interested in learning more about it, you may already have done this, but as new providers are being onboarded, we just wanted to be really clear on what it means, what access is allowed when you do this, and what the process is if you would like to. Next slide. All right, I think I'm wrapping it up here. For our Medicaid waiver application renewal, we'd really like to be able to share stories of how this benefit is supporting communities and families in Oregon. So we're trying to gather stories to help make our case for continuing HRSN. And our SNAP team developed this online form. It's open anytime. It's just an open link for you to submit any member and provider stories that come up, and we'd really appreciate if you have time. I know everyone's very busy, but if there are stories that really stand out to you or that you would like to share with us, we'd really love to hear more of those and be able to use that kind of in our defending of the HRSN benefit as we move along and hopefully renew. All right, and I think we're getting into our Q&A time now. So I'm going to pass back to Tanya to get us kicked off here.
Thanks, Leah. Sorry, I was looking for my unmute button. All right, so now we're going to open things up to Q&A. This is a shared space. so we want to make sure that everyone has time to ask their questions. Just be cognizant of how many questions you're asking. We don't want to put a limit on your questions, but if you've asked a couple, maybe pause for a sec for others to ask questions. Do not share case specifics, so ask general questions. And then if you have more case specific questions, you can always reach out to our email inbox and we can help.
Uh-oh.
Share suggestions on doing work. So suggestions, ideas. Oh,
Hey, you're back.
you
You're
have
back now.
suggestions. Oh, sorry, did I cut off? Sorry about that. And then we'll focus on questions from providers and community partners. If you are a CCO, we still want to hear from you, but let's prioritize this space for our providers. I already talked about the Q&A box, and some of you have already asked your questions in that inbox. And if for whatever reason you can't use that inbox, then you are welcome to raise your hand, or if your question is better asked out loud, that's an option for you as well. All right, and apologies that my internet's cutting off a bit. All right, Chelsea, if you wouldn't mind unsharing your screen so we could see each other, I will kick things off with our first question from Jacqueline, and I'll just flag this question for our colleague Tara to answer since it's a housing question, and I'll read it out. So it says, we have many households trying to apply for HRSN. Some of these are non-married families. How are we supposed to support these families and help them apply if the times for approval for individuals vary? So the likelihood that two OHP members from the same household would get support at the same time is unlikely. These households may not be on the same insurance or both have insurance, but we are only supposed to pay for the authorized member's support. This still impacts families significantly and could lead to a family losing housing. A clearly defined way to properly support a non-married partnered household with only one approved member would be greatly appreciated. So Tara, I'll hand that one off to you, please.
Thank you, Tanya. So this is a slightly complicated question, but not really as complicated as it seems. So the way that OHA defines eligibility household is generally based on the economic unit. So the tax filing unit generally means most of the time, but it doesn't necessarily always have to be that definition. For HRSN housing, a household can receive the benefit one time. So when there is a group in a home, if they are an unmarried, a unmarried group, but that considers themselves an economic unit, if that is the way that they function, if they are pooling resources, even if they're not on the same Medicaid case, as long as they are considered an economic unit together, then they would apply in that way. They would request the HRSN rent assistance as a family, as a household. And in that case, that would mean that at a later date, a different member of that household could not also request HRSN rent assistance. So in that case, if that household's authorized, if they are, regardless of where they are as far as their medical coverage, health coverage, if they're approved as one economic unit, then it pays the rent for the household. But in that case, everybody's income is included too. So in those cases, when there might be several sources of income, it could end up putting people over the limit, over the limit of 30% or below AMI. So that's one way to look at it. And then if a household is unmarried but does not consider themselves an economic unit, whether or not they're filing taxes together, they're an economic unit. But if they don't consider themselves to be an economic unit, then they could apply separately. And in that case, you're right, it might take, different processing times if there are two people, one in each defined household within that, under that roof in that unit. It may take different timelines for them to be authorized if there are two two different households applying. And in that case, just communication with the landlord is going to be important. So whether that's done through O&E or whether that's done through tenancy supports, if someone has already been authorized, it's just going to require more communication. Does that help?
Yeah, actually, that was incredibly helpful. Thank you. My second follow-up question to that then would be, in the situation where an individual, like a family, considers themselves an economic household, how can we prevent fraud, waste, and abuse when there is the one person being authorized, and then, for instance, those other individuals may or may not be on the Medicaid plan and not reflected in the household on Unite Us? How can we ensure, aside from the lease that's uploaded, because that's the only documentation that would include that the other members of the household, how can we ensure that we do our due diligence to make sure that that's reflected and that person isn't receiving duplicative services?
Now, most of this question might not be, I might not be the best person to respond to at least parts of this. I do know that during the screening process, providers should be asking, have you received this benefit or other benefits? And so hopefully that would be disclosed. I don't know if there is a way beyond that, beyond just seeking those answers in screening. If anyone else does, though, please go ahead and jump in on this. It looks like maybe not, and I think we can look a little bit more into that. I might have given you the best answer there is, but we'll check a little bit more and we'll make sure that we track this for you.
Awesome. Thank you. I just want to make sure that we're doing our due diligence as an HRSN provider to ensure that if there is a process that we can help to
I
assist
appreciate
with
that.
that, that we are doing so. So thank you
Thank
very
you.
much.
Thank you both. Is it Kara or Kara? Is that a follow-up question to this?
Yeah, I was just gonna
Go ahead.
say, asking for a rent ledger. Wouldn't the rent ledger show if they've already received services, um, prior? Like if there's anybody else, a rent ledger is gonna be for that household, and asking for a rent ledger, will show if there's been some HRSN payments.
Well, maybe it could. It's possible. It depends on when those HRSN payments were received. So now we have been HRSN housing has been live since November 1st of 2024. So it's been a little over a year. And so there is a chance that somebody might have received HRSN assistance in the very beginning, and even for arrears, so that they may be all the way done with their HRSN assistance by, as early as like December 1st of 2024. And in that case, it probably wouldn't show up on the ledger, and it might not anyway. A lot of times, a rent ledger just shows what's been paid. It doesn't necessarily show who the payment, whether there was a third party that the payment was made through. So it might work in some situations, but I wouldn't count on that as a reliable source.
All right. Thank you. Okay, I will go to our next question. Let me see. All right. I'm going to ask a question from Jennifer, another one for you, Tara. And the question is, a client's late fees exceed the upper payment limit in the month they were generated, December. Can we pay the remainder in the following months? For example, can we pay the remaining $500 in late fees with the January rent as long as the January rent and December late fee balance is under the upper payment limit?
And the answer to that is absolutely yes. It's the late fees will just continue to carry over, so they'll continue to be a payment that is due with that member's rent, and so it can be separated out into any number of months it takes to get that paid and keep under the upper payment limit, because that debt won't go away. It's still part of that rent owned for that period of time.
Great. Thank you, Tara. Is there any follow-up to that? Okay, I see some hands clapping. Megan, go ahead.
Yeah, thank you. I was curious, does this apply to other benefits? Like if someone's utility amounts are carried over to a future month, or anything else, right? Like we're not able to pay in 1 month because it would exceed the UPL. Can we carry things over? That's not how we've been functioning, so I just want to make sure we are following guidance correctly.
I apologize. I didn't fully follow that.
Oh, so the what you said about the late fees, that's new for me. It was my understanding that we have to apply, like we have to look at whatever's accrued in a given month and pay that up to the UPL, and it can't be carried forward. So I'm curious, is that specific to late fees for rent that we can move them forward to a future month? Or is that, can we apply that to other things as well? Like if we're paying a utility bill and we just pay like the amounts that are accrued a given month for that month of assistance. Like my usage was $250 this month, but I did have a past due balance of 60 from a prior month. We're not paying 310, we're paying the 250 for that month. So can I apply that guidance that you gave to other parts of HRSN housing benefits? Is that clear?
Yeah, I think so. And yeah, you can pay up to the upper payment limit. So with utilities as well, arrears can be covered. And so if that money, if they owe that money coming in, it can be considered to be, it's part of what they owe. So it's what's owed each month, not necessarily what's accrued each month. So if they've got that, if it's an ongoing piece of their, you didn't have enough to pay, someone contradict me if I'm wrong, but if January has some some utility owed that is up over the upper payment limit and it's carried over into February, then the payment date for that would be in February. So it's based on the date the payment is made at this point.
Okay. I'm gonna think about this because maybe I'm off base. But that's not how we've been applying it. Like even with rent, sorry, with late fees, if it was like a late fee for January, for example, that would have to be paid with January rent and January utilities, and could not we couldn't use February HRSN benefit to pay that.
And right, and it is absolutely my understanding that you should be doing that. And there was a change in the way that payments are being identified. If somebody here that is able to discuss payments a little bit better, that would be great. But there is a little bit of a difference in how we're doing the payment date. And I think that it covers kind of what you're asking.
Is that a change from January 1st?
It was a change talked about earlier in this meeting related to payment.
Tara, we do have billing folks on the call, and not to put them on the spot, but if either of you want to jump in,
Oh, they do. And
please
yay.
do.
Hi, yeah, I'm not going to be coming off camera because I'm not feeling well today, but it's so good to see you all. My name is Kathleen, and I am part of the HRSN policy team. Um, I'm not, I I joined this meeting for the Q&A session, so I missed what happened earlier, but my understanding of our billing guidance that we've created is that utility arrears do have to be attributed to the month in which the payment was accrued, so they can't necessarily roll over. Um, Late fees may be slightly different, especially when tied to rent, because we're trying to help avoid eviction for the member. And so spending all this money paying off rent and rent arrears, while still missing some of the late fees may still result in them being evicted. So this may be something we need to take back and just fully confirm that we've looked at it from all angles, but I think that's a good flag to raise just to make sure that late fees can be rolled over or not, because I think that you make a good point, um, especially if folks have had to wait for several months between when they were authorized by the CCO and when they actually start receiving payment services. We want to make sure that members are getting the full benefit.
Yeah, I mean, and it would be amazing if we could roll them over, right, to help prevent more evictions. It can be kind of tricky and time consuming to like highlight in a ledger like every single thing that's been charged to the tenant, like in a specific month, and try to figure out what each month is, especially if we're paying like 6 months of arrears. But further guidance would be really helpful.
Yes, absolutely. We will try and make this really cl crystal clear. I know it can be really tricky trying to parse apart all of the parts of these bills. So we really appreciate all the questions you guys keep bringing us because we want to know what is tricky or confusing for you.
I see that there are a couple hands up. If they are to add to this conversation, let's keep having this conversation. And if your hands are for unrelated questions, let's wait. But Katrina, I see your hand is up. Go ahead.
Yeah, thank you. I just would also like maybe some more clarification. And I recognize that this is a conversation that you'll need to have afterwards to follow up with us. So even for rent late fees, um, if a client is owing a late fee, let's say just a late fee for August, and no rent, then we let them know because that late fee is associated with that month. So we let the clients know, like, hey, we can have the benefits start in August and pay that late fee, but then you'd be kind of cut short for 1 full month of rent assistance, because that late fee is specific to that month. So then we give clients an option. Do you want it to start in August and we can take care of that late fee? Or do you want it to start in September so we can also pay rent and a late fee if the payment's going to be late? And kind of same thing with utilities because that new utility charge is specific to that month. So yeah, it might roll over, though I feel like that charge is specific to that month. So some more clarification, I think, would be really helpful.
Thank you, Katrina. Jennifer, go ahead.
Yeah, thank you. So this is my question. So I just want to make sure I'm crystal clear because this is a current client that we're trying to get caught up. So my understanding is that I can roll the late fees forward and pay them within the upper pay limit in subsequent months, even and that's how I'm going to carry forward. Tara, can you give me or Tara, can you give me a thumbs up if I have that correct? You're on mute.
I'm nodding because I don't know how to do the thumbs up on here.
You have a thumb.
Yeah, there you go.
Thank you. And then as far as the utility bills, I'll just note, uh, 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 it sounds like further clarification will be provided later about rolling utility bills forward. And I just want to add the nuance that, we may pay utilities in January and there may be a balance from the January services. And so my question is if would it be possible to roll them forward if it was a month where we already paid utilities? So it wouldn't add to their 6 months. It would still be within the 6 month window. It's the issue of trying to get the funds within the upper pay limit. So if January service dates we're still carrying a balance in February. Could I pay that because it's still in the 6 month window? I just need a new month's upper pay limit in order to actually make the payment. So I'll just add that nuance to that question because, of course, we want to observe the 6 month window, but sometimes it's the upper pay limit that keeps us from getting them paid in full.
Thanks, Jennifer. I know there's a lot of nuances to some of these rent and utility things that you all are seeing that we didn't necessarily anticipate or weren't aware of maybe happening. So I appreciate you all bringing these different questions to us so we can take them back and really discuss them. Thanks.
Thanks, Kathleen. And I know that there's a few comments that have come through in the general chat, and I wanted to open it up to folks. If this conversation hasn't fully answered your question and you put some comments in the chat, if you wouldn't mind coming off mute, you're welcome to add to the conversation out loud just to make sure we didn't miss anything.
Could I could I speak to I think there's a difference between the upper payment limit question around late fees and the months of service question around late fees because late fees could, we don't often run into the upper payment limit in Yamhill County, but um, we do, yeah, have some rolling fees from prior to the months of authorization, and it's very difficult to get an auth changed retrospectively to cover arrears. And when it's taking so long for approvals to come through, not always, but sometimes taking quite a long time for approvals to come through, those late fees are accruing. Yeah, so it would be really helpful to know if the late fees are on the bill, and don't are not specifically, it's not service, it's fees. Can we pay them in any month that is approved, as opposed to if they were accrued in a month, if they apply to a month that is prior to the authorization, that might be out of bounds. Sorry. So I don't know if that question is clear, but yeah, differentiating between whether the fees apply to the month prior to the authorization or are active during the months of authorization.
That makes sense. Thank you.
Thank you. All right. Anyone else from the chat have anything to add to this conversation before I move us to a new question? And just a reminder for folks, if you wouldn't mind putting your questions in the Q&A box, that helps us track them a little bit better. All right, I'm going to ask another question. Let me find one. Okay, this is about a home remediation application. A question from Kara or Kara. I'm sorry, I'll read it out loud, and this might be a question for Tara. So if a client has a pending home remediation application that was submitted in late 2025 and is still in the process of being screened, will they be required to have landlord approval if the lease doesn't require it? Care Oregon was requesting it from them, and it was the last piece they were waiting on.
This one's an easy one. The new rule is in effect. This request has not been authorized. The new rule applies. Just go ahead and let the CCO know. Just maybe reach out and remind them this isn't a requirement anymore.
Thanks, Tara. Another question for you. A question from Jay. My understanding of this program is that it's meant to support people who have temporary housing instability due to increased medical need. Why then are other people from the household restricted from accessing HRSN if someone accesses it before them? If there are two earners in a household and one happens to get sick, after the other one, they will still have housing instability. Or if their child gets sick and they get sick, confuses me. Do you have anything on that one?
Yeah, it's just the nature of the benefit. We are able to help each household one time. And so it's a household benefit. It covers the rent for the whole household. An individual is not having their portion of the rent prorated into a payment. So if there are two members of the household and one member has had a health condition worsen and they are now eligible for rent and utility assistance, as long as they are a household, then the whole rent will be paid. I hope if that helps at all. Hopefully, but that's why it's not broken down per individual. It's a household level benefit. We want to make sure we're taking care of as many households as we can.
Okay, thank you. I'm going to ask another question from Kathy about rent assistance and home mods. So the question is, if the member is approved for rental assistance and then would like home modifications, does the member have to apply for the home modification using the Home Changes for Health and Safety request form? I am an open card HRSN provider.
they do need to submit a request for, so if they've already submitted, been authorized for the rent benefit, then requesting a home modification is a second request. It can all be on one request, but it would have to be that way when it's submitted.
Thank you, Tara. And I will just say I appreciate that this person added that they're an open card provider. That always helps us know how to answer your question if you're an open card or a CCO. So thanks for that. All right, let's scroll through these questions. Um, okay, another billing housing rent question. All right, from Megan, can we review the rent and utilities multi-household dwellings guidance in the CCO billing guide? It now outlines that we need to calculate what a member's rent would be based on how many bedrooms their household occupies. What would we do if the member reports that their rent is either lower or higher than the proportional amount? How should we open rent utility cases for these households? For example, do we put the size of the total amount of bedrooms in the house when opening the case or applying the fee schedule, or do we use the amount of bedrooms that the household occupies?
I can answer part of this. And I there are portions I am not going to be able to answer, but I will do what I can. So one way, and this is not the only way, but one way to do this potentially is to have each of these members get their own landlord tenant verification form filled out, which is a really simple form. And then that would determine, which member's responsible for what. So it doesn't necessarily have to be just divided based on the number of people if there is a landlord tenant agreement form that specifies a certain amount for that member. So that's one way to do it. As far as calculating it in any other way, that's where I hope payment wants to talk about it. Sorry, Kathleen, or anyone else.
Hi, sorry, Jake and I have been in the background talking about the previous utility things. Can you please repeat?
Yeah, do you want me to reread the question, or Tara, are you able to summarize?
I can summarize it.
Okay.
So the question is, when there are multiple household dwellings, it sounds like in basically multiple households under the same roof in the same unit, and they're not applying as a household for HRSN rent and utility assistance. They are considered separate households in that home. Um, the person, Megan, would like to know how many bedrooms how to calculate the number of bedrooms that the household occupies, each specific household within. Should have just read you the question out loud. What should we do if the member reports that their rent is either higher or lower than the proportional amount? How should we open rent utility cases for these households? Do we put the size of the total amount of bedrooms in the house when opening the case and applying the fee schedule, or do we use the amount of bedrooms in the household that the household occupies? So my response to this was, one way to deal with it is that each member, if there are separate households within the same unit, each member could get a separate signed landlord-tenant agreement that does specify exactly what their amount is, if it wouldn't just be something that could be divided in two or three. And then as far as calculating what each member's rent would be, say in a household where there are, 3 adults and 4 bedrooms, I think that's kind of what we want to know. Like, how do you calculate that if there isn't, aren't those separate rent agreements?
That's a good question.
Kathleen, I can jump in. I
Yeah, go for
think
it.
our position would be that the UPL, or the upper payment limit, the monthly benefit maximum allowable amount, that would be applicable would be the number of bedrooms, likely just one bedroom, that the member is occupying in that household. So that like if there were two members, Medicaid eligible for HRSN rent under the same roof, and were getting their own benefit separately, that they would effectively just get a benefit up to a one bedroom defined upper payment limit.
That this was my question, so I'll jump in. That makes sense to me. I haven't finished reviewing all the new guidance, but I don't know that that's written anywhere where you would, when like opening the rent case, you would choose the fee schedule for the amount of bedrooms that the household occupies and not what's on like the lease. And then my other question, in the billing guide, I think this is new now where it like writes out that you should calculate someone's rent based on the amount of bedrooms they occupy, like proportionally. Before that was in the OAR for utilities, but not for rent. So we could just use like self-attestation. So I'm curious, and based on what Tara, you said, it sounds like if we have the tenant landlord verification form, that would supersede the math problem, right? If the member says the rent is higher than half of the rent for whatever reason.
Yes, that would be considered the rental agreement. And so to me, that would be the simplest way to do things like that rather than having to deal with all the calculations if you've got a landlord that's willing to do that. And it wouldn't change. I mean, they've got a lease, the lease has the terms. This is just a document to be used for purposes of HRSN. So
Okay.
it's not as if they need to modify the lease.
Okay, I'm curious, like if a landlord is unwilling to do that additional verification form, and we're working with someone that says, I have the primary bedroom, I pay 2/3 of the rent for that reason. Do we have another option, or do we just have to use like the math problem?
That's a question I think we should talk about internally. So I don't think that is not a nuance we've thought about here either, and it's good to have an answer for that. So we will get back to you on that one too.
Okay, thank you.
Thanks everyone for the questions and really robust conversation. There are still several questions in the chat, but I'm cognizant of time. We are scheduled to end at 10. So I don't think we are going to get to everyone's questions, but we will take these questions back and send out answers. So keep an eye out for that. We're not going to ignore your questions, but we'll commit to following up on questions that we don't get to in the next like 2 or 3 minutes. So I might read one more out loud, try to answer that, and then we'll get back to the rest of y'all if we didn't get to you. And I apologize for that, but I think this was a very productive conversation. So I'm gonna read one more question. Let's see. Okay, a question from Joy about self-attestation for domestic violence cases. The question is, I understand that self-attestation is acceptable for safety. What do HRSN providers need to do for documentation in this regard? Is there a form to complete that's available? I don't know who can speak to that one or if we have the right people for that. Tara?
Tanya, I don't think we have a form for that, and I think we should. Um, I think this is a very good question. I think just a simple statement, even a verbal statement is enough, but a form might be a nice thing to have just to make it a little bit simpler. So we'll think about whether we can do that.
Okay, and add to our thinking a comment from Katrina. Can you use the VAWA form?
VAWA protections don't apply to HRSN rent assistance. That applies to federal programs. I'm not sure. Sarah would know, Sarah Quick, who is our new housing OPA 4 and might get a chance to say hi to you all right now. Sarah might know a little bit more about that form, but it's not a necessity here. If anything you choose to use to document should be fine, as long as you're protecting the member's information.
Okay, thank you, Tara. And I know we are right at time. So Chelsea, if you wouldn't mind putting our slides up again, and I will close us out. Again, I'm so sorry that we didn't get to all of your questions. But I will quickly share the upcoming opportunities. So next slide, please. All right, for 2026, we are, upon popular request, meeting bright and early, 8:30 to 10 a.m. usually on the second Wednesday of the month. If you're paying attention closely, you'll notice that a couple of these dates aren't on the second Wednesday, and we moved them to account for holidays. Most of them are on the second Wednesday, 8:30 to 10, and then the registration links are there on the screen, and we'll also send them out in our follow-up email. Next slide, please. And we value your feedback. I will say that this is not an avenue for asking questions. We have our HRSN email address for that, which hopefully someone can add to the chat for me. But we do value your feedback as far as how we structure these sessions, how we go about answering your questions, or what updates we provide, whatever you want us to know about how we use this hour and a half together every month. We welcome your comments and feedback. So if you use your cell phone camera, you can hover over this QR code and access that. And someone's asking, can you post a link to the registration for future meetings, please? We'll drop the link to our website that has all of them. So I will do that right now. So there's the web page. That is our provider training web page where we have all the links to future sessions, and then that's where we'll post the slides and recording of today's session in the next like 2 or 3 days or so. And with that, I think we're gonna leave it. Oh, one more slide. Thank you. This slide just has the links to our web pages, but the main one is the one that I just put in the chat, and then our provider page, which you could find a link to that from the link I put in the chat. So those two websites, our provider webpage and our provider training webpage, are the two resources that will have most of the information that you need. So once again, thank you all for joining us so much and for taking time out of your mornings to be with us here. We look forward to seeing you all again in February. If you have any questions in the meantime, the hrsn.program email address is in the chat. And I think that's it for today. Have a great rest of your week, and thank you to our OHA team for being here and answering questions. We appreciate everyone's help. All right, take care, everyone, and see you next time.